Welcome back to the Vita Mentality podcast. I'm your host, Angel Monroe. We're talking all things health and wellness, and we're looking at ways to live a vital life. Short disclaimer, this is not intended as medical advice. This is just for general purposes only. So welcome back. This week, we're talking about autism, autism spectrum disorder, so ASD, attention deficit disorder, so ADD, and with hyperactivity, ADHD. I decided to lump them all together because the way that they're diagnosed, there's often a crossover. People can get dual diagnoses, or they can have one diagnosis at one time and then get diagnosed for the other one later on. And I think it's pretty clear to me anyway that it's because of the diagnostic tools that we have available. I'm going to go over that in a minute. So we're going to have a look at how it's diagnosed, what are some of the root causes, does the diagnosis address all of the different root causes that can be possible, and some solutions. So another disclaimer that I want to make is that you might hear me challenging the way that these conditions are diagnosed and the way that they're treated in the mainstream. And I just want to be super clear that I'm not dismissing anyone's real life experience. My biggest motivation for exploring this is that I think that because of the way that it's treated in the mainstream, that it doesn't drill down enough to what the individual root cause is, and so people miss out on appropriate treatment. So that's the whole purpose of today. I've had both personal and professional experience in this area, so I totally sympathize about the real struggles that families can have. And this was primarily a childhood illness, but now adults are getting diagnosed with it as well. But yeah, anyway. So the pathology of ADHD this is actually for both, actually. The pathology is unclear, but this is specifically for ADHD out of Medscape. So this is what doctors will use. Sometimes they, have a hard time getting through all the research because they're so busy. And so they will go to a source that will kind of consolidate all the information. Medscape is one of those that's used kind of globally. And so this is directly from Medscape on ADHD. The pathology of ADHD is not clear. The diagnosis of attention deficit disorder is based on clinical evaluation. No lab-based medical tests are available to confirm the diagnosis. So, like I said, that's pretty similar for autism. And, although in studies, sometimes you will see that they might use different brain scans, or they might talk about different neurotransmitters. Actually, there is no clear biological explanation. And they use a questionnaire. It's called the DSM-5, and this goes for autism, ADD, ADHD, anxiety, depression, those kinds of illnesses. They're diagnosed using a questionnaire. No pathology is usually included. And I think that, as we'll get deeper into it, I actually think the reason why there can't be a test is because it's a too broad a term to explain all of the different things that could be happening for people, and there are too many different causes. There's not one cause, and the only way that you can assess that is on an individual basis with a full medical history, diet history, family history, and anyway, so let's have a little look at the DSM-5, just so we get a little bit of an idea about how it's actually diagnosed. Like I said, it's a questionnaire. Basically, for these conditions, there's a few sections, and you have to hit at least a few of the few of the points in this questionnaire out of each section to qualify having that condition. And they're quite broad. So I just want to read a few out. I'm going to read them out from autism first. This is one criteria. So persistent deficits in social communication and social interaction across multiple contexts is manifested by the following: currently or by history. Deficits in social emotional reciprocity, ranging, for example, from abnormal social approach and failure for normal back and forth conversation to reduce sharing of interests, emotions, or affect, failure to initiate, to respond, or to respond to social interactions. Deficits in developing, maintaining, and understanding relationships, ranging, for example, from difficulties adjusting to behavior to suit various special social contexts, to difficulties in sharing imaginative play or in making friends, to absence or interest in peers. So you can see that it's quite broad. There's, if we're talking about autism, there's a very big difference. I just read out a couple, by the way. It's much longer than that. But what I was trying to demonstrate was how broad that interpretation can be. And this is just up to the person that you're sitting in front of. And, there's a very big difference between a child who's been diagnosed with autism, who, say, has been hitting all their milestones, say they're 3 years old, hitting all their milestones, walking, talking, and then all of a sudden something happens and they totally regress. They lose eye contact, they stop talking, they stop socializing in the same way, they stop being emotive towards their family, and then put that to someone who is just a little bit of an introvert, who gets really interested in the same topics, or maybe wants to eat the same piece of toast every day. They would still fit into this same criteria and they'd still get the same diagnosis and the same treatment. And to me, that's totally different things going on in terms of what the root cause could be for why that's happening. So, the first one could have some serious toxicity damage, and the second one could just be a little bit nutrient deficient. And we're treating them the same. And this word gets thrown around a lot, neurodivergent. And this is just, for me personally, I actually don't like that word. There's no pathological or biological consistency in any changes in the brain or the neurotransmitters, no consistency across the board, nothing that needs to, so then it's not like you're born different. I don't think that's the case. I think it's generally something that can be fixed. That's the reason why I don't like that term, because it insinuates that it is something that is unchangeable, whereas I think there's usually always an opportunity for healing for humans, that we heal and we adapt. So anyway, that's my 2 cents on that. So now we're going to have a look at ADHD. This is the criteria. I'm just going to read out a couple again, just so you get an idea about how broad this DSM-5. Remember, this is the gold standard for diagnosing this condition. Doesn't matter if you go to your doctor and they send you to the psychiatrist, that everyone is going to be referring to this. So here is one: a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development as characterized by 1 and or 2. So you've got to get 6 or more of the following symptoms that have persisted for at least 6 months to a degree that is inconsistent with developmental level, that negatively impacts directly on social and academic occupational activities. First problem for me there is, what is the appropriate developmental level? What is actually normal? It's a very hard metric to find. Yeah. So things like often fails to give close attention to details, that makes careless mistakes in schoolwork, at work, during other activities, overlooks or misses details, work is inaccurate, often does not seem to listen when spoken to directly, mind seems elsewhere, often has difficulty organizing tasks, activities, difficulty managing sequential tasks, difficulty keeping materials, often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, schoolwork, homework. Anyway, it goes on and on and on. That's just a couple of examples. And again, just to draw a picture, say you've got Jimmy, he's diagnosed with ADHD. Some of his symptoms are he smashes his head on the table every night at dinner because he doesn't want to eat dinner. And he does that repetitively. And at school, he doesn't listen, jumps up and down in his chair and throws things at the teacher all day long. And then you have Sally, who goes to school, doesn't spell very well, sometimes gets spelling wrong, a couple of times a week forgets her workbook. You get the picture. She would be diagnosed with the same condition and given the same medication as Jimmy. And, Jimmy could have had, again, some kind of like toxic damage. He could have had trauma. There's a few different things that could happen with Jimmy. And then I think I said Sally. Anyway, the girl, she could, again, just have nutritional deficiencies. She could have poor light environment, so too much artificial light. I could go on and on and on. I'll go more into detail about those after. Again, the treatment's super different. So you'd be trying to detox heavy metals out of the kid who seems to have significant heavy metal toxicity, and the child whose light environment is to blame. You would be making sure she gets morning light and maybe putting in some, proper lighting into the house that's more conducive to the circadian rhythms, like red lights at night. This is case by case basis, and you can see very, very different treatment. What happens in the conventional system, for autism, generally it wasn't medicated, but it's starting to be, and it's off. The children are now being given antidepressants. I think I've gone over in another video some side effects from some antidepressants and some of the amphetamine-based drugs for ADHD, but I'll just go over two again for the purpose of this video so you get an idea. Before I say that, I just want to point out that pretty much every child, especially if it's significant, there is a gut issue and there is a neurological issue. And most people by now would have heard of the gut-brain axis and the microbiome. And when there's damage to that area, there's neurological issues follow. And so it's really important also that those are both addressed in any treatment. So in the conventional treatment, unfortunately, this is dexamphetamine. There's gut issues as one of the side effects. You've also got suicidality, heart palpitations, psychosis, mania, aggression. Like aggression's one to note, especially for the children who actually already have aggressive element to their ADHD. Anorexia, weight loss, goes on and on. You get the gist. For autism, it can, like I said, they can be given SSRIs, so serotonin reuptake inhibitors, that are usually prescribed for depression, and Lexapro is one of the ones that's given to children quite frequently. And you can get abnormal bleeding, suicidality again, psychotic disorders, gut issues again, which is you cannot kind of heal the neurological system if you're insulting the gut. And yeah, anyway, goes on and on and on. That's just a few of them. I think it's important to note, I've got two kids, one in their 20s, one who's still a teenager, late 20s, and there's 11 years between. And I remember when he was a kid, I knew like one or two children who would have one of these diagnoses, and usually it was quite pronounced. And now I would say half the kids I know probably have one of these diagnoses, and ranging in severity. Some are very light, and like I said, they still end up getting prescribed the same drugs. And it's even known in the literature that some people get diagnosed with these conditions when they don't have it. Not to say that they don't need something that needs to be treated, but like I said, it's just missing the mark in terms of actually assisting that person on an individual level. So that's why you get crossover in diagnosis, misdiagnosis. People get undiagnosed or wrongly diagnosed because it is too broad, and it's not addressing, like I said, the root cause. And it's so, those questions are super subjective as well. So I guess my biggest problem with it is I don't think that is a strong enough framework to medicate. Yeah. And then the other thing is, I spoke about nocebo, I think one of my last podcasts. So nocebo, you heard of placebos when you think you're taking a medication, and in a study they give you a sugar pill, and you end up say you're taking the sugar pill instead of a Panadol for a headache, and the headache goes away because you think it was the Panadol. That's placebo. Nocebo is when you think the treatment or the diagnosis is real when it's not, and then you end up manifesting those symptoms or those side effects. That's called nocebo. And I guess that's one of the worries. I think if people get a diagnosis for something that encompasses all of these symptoms that they don't have, they can end up manifesting them. And this is completely anecdotal, but I saw a child I know, kooky but engaging, kind of super bubbly child, gets an autism diagnosis, and then a month later they're using one walking stick, and they've got the noise cancelling headphones, and they've become withdrawn. And I don't know enough details to say for sure, but I always wonder, if just even having that diagnosis, how beneficial it can be, rather than just saying, okay, so you've got some gut issues and some neurological issues, and they're causing this, and let's deal with that directly. And I think that can be a way better way to go. So so some of the things that can happen, so heavy metals like aluminium, lead, arsenic, and mercury can cause neurological damage. There are links with these conditions and these heavy metals. There's lots of sources for it. Arsenic can be agricultural, so it can be through the food. It's when like preparing and soaking grains come into play. It's really important you soak your grains and you get rid of the water, and then you cook them. Mercury, especially for older people, can still be in amalgams. Now for tooth fillings, they use something called, the main thing that's used is a resin composite, which actually has plastics and microplastics can also be a cause, so they're not necessarily a better option. Things like porcelain are the cleanest. Mercury still in the flu V word, and it got taken out of all of the other childhood V words in the late 90s, but it got replaced with aluminium. And again, this is kind of controversial. Aluminium is also a neurotoxin, known neurotoxin, known to damage the gut, the interstitial, is that the right word? Lost my train of thought. Anyway, the gut lining. And so you get that leaky gut, that hyperpermeability, and then you kind of get large particles coming into the bloodstream, and it causes damage. You can end up getting allergies and things, also neurological damage. So yeah, like I said, with the V words, it's kind of difficult topic, controversial topic. But the thing is, with all toxins, some people are better at getting rid of toxins than others. That's why some have a reaction and some do not have a reaction. Most people have the ability to get rid of a certain amount of toxins, but the problem is that we're bombarded with them from all different angles now in our modern life, that we have like a toxic overburden, and that's when you start to see lots of health issues. So for some children, for whatever reason, and it has to be assessed on an individual level, they cannot process these heavy metals. And so even a child might even have their V words up until they're 4, and then all of a sudden, like, I've described before, a child has seemed fine. Maybe they've had a few allergic reactions when they've had these things, and then all of a sudden at 4 they get their last one, and then a week later they stop talking. This happens. And I think that we dismiss this a lot because it doesn't happen to every kid, but unfortunately it does happen to a lot of kids. So yeah, but it's not the only cause, and that's what people get stuck on. They'll say, well, this is the cause, and then and someone else will say, oh no, they didn't have that, so it can't be the cause because they've also got this condition. It's because there isn't one cause. There's some links with having cesareans to having these issues, either ADHD or ASD, and that's because our microbiome, like I said before, so all of our gut bacteria is so integral to how our neurological function, how well it is functioning. So that can be a cause. Non-steroidal anti-inflammatories, if a mother has a history of taking them, so things like Nurofen on a regular basis. There's not a whole lot of research, but there is a possibility. Definitely causes known causation to gut damage and to that intestinal hyperpermeability, like I said before, and that leaky gut. And so it's kind of indirect evidence. Certain nutrients, like we need really good fats, like from fish, like cod liver oil, and butter and olive oil. These kind of fats are protective from eggs. Dairy, protective to the neurological system. And a lot of people have a lot of seed oils, so canola, vegetable, rapeseed, soy oil, sunflower oil. Nothing wrong with the individual plants, but what's happened is there's so much chemical extraction that then they're damaging, and you end up with this imbalance between omega and omega-3 and omega-6. So that can be a cause. Actually, another cause is when a child has hit their development milestones. For instance, a child requires a certain amount of crawling for the left and the right brain to integrate properly. And if a child has crawled too late and then started walking, or only crawled for a little bit and started walking early, like say they started crawling at 6 months and then they start walking at 9 months, or they start crawling at 1.5 years, and then they start walking at a month later, there's not enough crawling. That can be a causality for these two conditions. And so you can see what I'm saying is that if you're the child that has not crawled, then your treatment is possibly going to focus around retraining and reintegrating that left and right brain hemispheres. And so you would do things like occupational therapy, and at Steiner schools they do something similar, and it is called extra lesson. They also do curative eurythmy, which is a kind of dance, and there'd be drawing and movement and things included, physical activity that would get that integration happening again. If it's a child that's had the heavy metal toxicity, you would be giving them things to try and get the heavy metal out of the body, and then you would be giving them other herbs and nutrients to heal the gut and heal the neurological system. If you had a child that had a cesarean, then maybe you would be working on the microbiome. You see what and you might get kids that have a combination of these things. And this is the point. This is why there's so many differences in how it will manifest, and why the only way, in my opinion, to treat it is to get to the bottom of what happened initially and work there. And like I said, the body always heals. This was always thought of, usually, depending on the severity, as something that children would often grow out of. And I think the way that we're approaching it, and especially with lots of adults now getting diagnosed, I think we're starting to look at these conditions more as something more lifelong. Not to say that they're not, but I just think it's interesting to think about, because, yeah, like I said, I can't see a reason why people can't find ways to heal at least somewhat. Just look at a couple of other things that can be causing it. So I said non-steroidal anti-inflammatory, seed oils, aluminium, lead, arsenic. Lead, building materials is a big one. And so is even like our building materials of our homes, but also of schools. I was lucky enough when I first started studying, because I had a 10-year break in between getting my degree, I was at a college. There was a woman called Nicole Bishma, and she's actually gone on to, she's got her own college, building biology. She's a bit of an expert in, health in regards to our the environments that we're in. And I remember she brought in a Geiger counter into the classroom and held it up to, in the room. We had artificial lights everywhere, fluorescent lights, and I can't remember what the reading was, but she was demonstrating that the room was completely the wrong environment for learning. And even that sometimes can simply be the reason why a child is having a hard time in school. Could just be the fact, not for everyone, of course, but for some children it might just be the fact that the environment in the school is not conducive to learning, and they're a little bit more sensitive than the person next to them. Pesticides is massive. If you have a issue and you fall into either of these condition categories, then that would be the first thing that I would remove. You can't wash a pesticide off. You can wash some off using baking bicarb soda, but they're fat soluble and water soluble, so impossible to completely get off. And yeah, that would be the number one thing I would be doing first. Microplastics, I said. And another massive one is additives and artificial colorings and all kinds of what. If you look at a packet of food and it's got things that you can't pronounce, then kids shouldn't be having it. What are some of the non-negotiables that I would say before you did anything else? If you are suspecting you or your child needs one of these diagnoses, or before you do any other kind of treatment, I would be cooking most of your food or buying food that has ingredients that you can understand, and that avoids seed oils and that's organic. I'd be spending as much time as I could outside. The light that we're in, light is a nutrient. The light that we're in dictates the way that our neurotransmitters and our hormones and our metabolism and everything functions. And children often aren't getting the right amount of light. They get a lot of screen time. And this is a huge problem and indicator for these conditions. So I'd be getting them outdoors in the morning. If you're an adult, same. When you wake up between 7 and 9, at least like 20 minutes, half an hour. If you're having neurological issues, gut issues, you need some outdoor light. And it is quite possible that you might even need to change the lighting that you've got at night, depending on the severity of your condition. And the other thing is too, that being outdoors, changes mood. So if there's a mood component, then definitely getting your kids or yourself, if you're an adult, hands in the dirt. And I'd be doing grounding every day, because often people who fall into these categories are not in their body. So bare feet on the earth. If it's super cold here today, I usually take my shoes off when I go for a run. And I couldn't today, which is rare for me. I put my hands on a tree instead. What else have I wanted? What did I want to say about non-negotiables? Definitely fermented foods and bone broth, because like I said, there's going to be a gut element here, and those two are the best things that you can do for healing your gut. Any fermented foods, naturally fermented foods, and a good organic gelatinous bone broth that's going to heal that gut lining. Like I said, organic food, avoiding processed foods, and definitely using natural materials, natural fabrics, natural cookware, just avoiding toxins as much as possible. And, for children, that can mean, swapping over toys and things as well, to things like that are made out of wood, silk, wool, those kind of fabrics, those kind of materials. I think I said filtered water. So in terms of some extra therapeutics, look, if people need therapeutics, and if you start to look at herbs, it's so variable because it depends on what's actually going on for the individual. So I'm not going to talk about herbs at all, but I am going to talk about some things that are just probably going to be essential for everyone who fits into these two categories. If you've got gut issues and if you've got neurological issues, and both at the same time, these things are going to help. Silica, there's a few different ways that you can take silica. I have it on the store in a homeopathic form, really good for getting rid of aluminium, great for children to have if they've had the V words, and to help get that excess aluminium out of the body. Children respond really well to homeopathics. They're energetic beings, and it's energetic medicine. Minerals, being well mineralized. When you've got lots of minerals, you're able to chelate and get rid of heavy metals. So one, I love fulvic acid to remineralize. Just having a whole food diet, which is something in the non-negotiables that you should be having anyway. And magnesium is also fantastic. Magnesium baths is a really great thing for a child to have every night if they fall into that category. Getting magnesium through the skin is much better than taking it orally. It's the best way to get it. And you also get that sensory kind of healing from the warmth of the bath. Castor oil packs over the liver help with the detox. Like I said, extra lesson or occupational therapy, depending on what the cause was of these issues in the first place, but that can be the perfect thing for the right child. Cod liver oil, best way to take omega-3, best way if you're going to supplement vitamin D. Vitamin D is essential. You can't supplement vitamin D unless it's coming out of a food form, like cod liver oil. Even butter and eggs have a certain amount, but you need to get out in the sun. But cod liver oil, if you are going to supplement with vitamin D, that's where you get it from. Also omega-3 and A, so it's a natural source of all of those. Any supplements that are lab made, they're going to have a certain amount of toxicity, and we've got a toxicity problem here, so I don't recommend that. Zinc as well. So zinc through food, again, I wouldn't recommend a lab-made supplement. The best way to get it if you're going to supplement is either a powdered oyster capsule or a powdered beef liver capsule. I sell both of those on the store. Yeah, so where am I going now? Gluten and sugar often gets brought up as a therapeutic. And I think the best way to start is to start off with organic food and whole food, and including fermented foods and bone broth. And then if you need to start eliminating foods, then sure. But the problem with, there are lots of diets that people recommend. The problem with any elimination diet is it does affect the microbiome. Bacteria are there to bioremediate and to break things down. And when you start taking things out, you actually lose the bacteria that are required to break that certain thing down. And you end up kind of putting yourself into a corner where you start reacting to all kinds of things because you actually just don't have the diversity to deal. So I've said this before, there's a super big difference between a cookie from the supermarket that has all those non-pronounceable additives, seed oils, yucky things in them, and to one that's made out of home with organic butter, organic raw sugar, unbleached flour, and an organic egg. So completely different. So start off with the basics, and then if you need to start reducing some of those things, then work your way to that. I think, I'm not sure if I mentioned EMFs before, electromagnetic frequencies, but they are also an issue, and there are links to it in the literature and the scientific literature. I should have mentioned this before, but I've also said this in my podcast that I spoke about EMFs. One of the things that children often are given now that are autistic or even for ADD are noise cancelling headphones, and they're wireless, and it's going directly into the brain, which to me doesn't make any sense when that's where the damage is, to put something on their head, which can cause more damage. So go for wired. A lot of the time too that there is a disconnect, and I think that the antidote should be things that make you more connected. So less encouraging things that cut you off from the world, and more encouraging things that connect you to the world. Like I said, with the grounding and the morning light, being outside, doing some gardening, like doing things that actually earth someone rather than taking them away. And I've just there's one more way to think about this. The brain is one of the most electric parts of the body because we're hydroelectric. That's why you can do like an EEG on a brain to track the electrical field. The heart is another area where you do an ECG. And so think about it in terms of sensitivity. We've got non-native electricity, which is things that are generated through the earth. This is natural electricity, like we are natural electricity. And then we have non-native EMFs, so man-made electricity. And man-made electricity, it affects natural electricity. And so it's a really good way to frame it. So things like EMFs, screen time, stress, artificial light, poor sleep, processed food, these all take away from our natural charge. And things that build our natural charge, our natural electricity, is sleep, minerals, whole seasonal food, movement, sunlight, barefoot grounding, hugs, patting animals, and joy and relaxation. So anyway, this topic is so broad. I'm sure I've missed things. And, if you've had a diagnosis in either of these areas and you feel like you weren't represented in this conversation, I apologize. It's just hard to cover it all. And what I wanted to do is just shed a little bit of light on possibly another way to look at this. If you would like to book in a session with me to deal with this issue on a one-on-one basis, please do. I'll put references in the show notes. And as usual, thank you for listening.